The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they may have, and they should seek the assistance of their healthcare professional for any such conditions. Hello. Welcome to Mind, Body, Luminosity, the podcast where we dive into the realms of health and wellness to equip you with the tools that you need to live a vibrant life. I'm your host, Dr. Holly Kendra, and I'm thrilled to be your guide on this journey towards optimal well-being. Now, we're coming to you a little bit later today than we have in the past because we were having some technical difficulties, and I don't feel bad saying that because I am not a tech person whatsoever. And my guest today, I'm sure I can safely say, is also not a tech person. So we had a lot of adventure trying to make sure that we could make this call happen because my guest today is Dr. Rebecca Miller-Afsari. She is another naturopathic doctor, a fellow friend. We went through medical school together back at Bastyr University. And one of her specialties is in hyperbaric oxygen therapy. And as that is an emerging therapy and therapeutic technique, I really wanted to have her come on today and talk to you all about it. Now, Rebecca lives in Indiana, so it's kind of hard to get her all the way up to West Michigan at the drop of a hat to come chat with us. So we were trying to do this call remotely, and so that's therein lies the source of our technical difficulties and troubles trying to get this all connected. So welcome, Rebecca, to our podcast today. I want to just ask if you could take a couple minutes and tell our listeners today a little bit about yourself, who you are, what you do, your practice, things like that. Hang tight for just a minute, okay? Just pause. The information provided in this podcast and supporting material is for general informational purposes only. It does not constitute the practice of medicine or other professional healthcare service, including the giving of medical advice. I am a doctor, but I am not your doctor, and no doctor-patient relationship is formed. The use of this information and any materials linked to this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they may have, and they should seek the assistance of their healthcare professional for any such conditions.
Like your audio levels aren't showing up.
Yeah, it's not looking like you're talking anymore. Can you... Yeah, your audio levels aren't showing up on our end now. I guess turn your headphones back off.
Or can you adjust the microphone?
Or, hold on, something's going now.
Okay.
The information provided in this podcast and supporting material is for general informational
just kind of
purposes
deal with
only.
the
It does
echo?
not constitute the practice of medicine or other professional healthcare
isn't
service,
echo.
including the
There
giving
is?
of
I can
medical
hear
advice.
myself echo.
I am a doctor, but I am not your doctor, and no doctor-patient relationship is formed.
Did you turn your
The use of
headphones
this
off?
information
Did
and
you
any
turn your headphones
materials
off?
linked to this
Or
podcast
did you?
is at the user's own
Oh, she
risk.
did. That's
The content of this
That's
podcast is not intended
weird.
to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining
guess
medical
it should
advice
be
for
okay.
any medical
Yeah.
condition
As long
that
as
they
you're
may
okay
have,
with it.
Yeah, I can
Okay.
deal
and
with
they
that.
should
So
seek the
Okay.
assistance of their healthcare professional for any such conditions.
Okay. Me tell him I'm out. Okay. Okay.
All right, and we're back. So, Dr. Rebecca, it sounds like our technical difficulties were back in force and we weren't able to hear you. So, let's give this a try again. Go ahead and give us a little brief introduction about your relocation, your practice, and your, how you work with hyperbaric oxygen.
Okay, thank you. Well, first off, it's a pleasure to be with you here today, Dr. Holly. I, as you said, am a naturopathic doctor and also a licensed massage therapist. I relocated just last summer back to Richmond, Indiana, and started up my practice there. But before I moved, I was helping. One of the things I was doing was helping as a clinical director, medical director of a hyperbaric oxygen facility, providing patients with mild hyperbaric oxygen therapy, which is primarily what we're going to be focusing on today. And both through my experiences working with patients and also through having my own experience using hyperbaric oxygen therapy, or HBOT as we like to call it, I was able to see some really incredible changes in both my own health and in my patients.
Awesome.
I also do a lot of other treatments with people, but this is something I'm very passionate about. So I'm glad to be here today.
Awesome. So let's jump right in. My first question for you is I'd love it if you could provide an overview of hyperbaric oxygen therapy, the applications, and how it promotes health and wellness.
Okay. Well, everyone knows that we need oxygen to live, right? Unless you're a plant, and then you need carbon dioxide, right? But we're not plants. We're human beings, unless you know something that I don't. And so that means we need oxygen to breathe. And our cells, down to the tiniest, bit of our body, need that oxygen in order to make energy and in order to be healthy, right? Bringing it back out to a macroscopic whole body level, like oxygen is what makes us vital. And so hyperbaric oxygen, basically it's like this chamber. It's this, well, a mild hyperbaric oxygen chamber is a soft-sided chamber that looks kind of like a giant tube of toothpaste, or like, one of those those biscuit cans we used to have as kids, that like it's like a giant white can, and when there's not a patient in it, it's deflated and it looks sad. But then you get inside of it, it fills up with air, and it becomes pressurized, and it gets pressurized to about 1.3 atmospheric pressure, ATA, 1.3 ATA. And that means that the oxygen in the chamber gets forced into your tissue. And so you get more oxygen in your body than you would if you were just breathing regularly. It like bypasses your regular respiration, your lungs, and is forced straight into your plasma. And that means it can like bypass your blood-brain barrier and go straight into your brain, which is one of the biggest things that it's been used for with healing. But it's also been used for healing a lot of infections and wounds. Because if you have a bacterial infection, for example, like an open wound on your skin, then you have this problem where, the bacteria don't like oxygen. So you surround them by extra oxygen. And not only does it help your immune system to fight off the infection, but it also makes the bacteria like they can't breathe in an anoxic, or they want an anoxic environment, a non-oxygenated environment.
Right.
And so we
right. A lot
boost
of them are
that oxygen.
anaerobic. Yeah.
Mhm. Yeah.
Yeah.
So,
I'm going to take you back. I want to touch a little bit on like how we got to where we're at with hyperbaric oxygen therapy. Like, it seems like it kind of came out of nowhere, but it's been around a lot longer than we realize, right?
Yeah, it has. It has been around since 1662. Most people would have no idea. In 1662, it was first discovered by a man named Henshaw. He was an English physician, and he built the first chamber, and he called it the domicilium. And then, over time, there were other people in England and in France that started using it as well. Some of the earliest uses of it were for surgery to help improve healing time for patients. They would do the surgery sometimes inside the chamber, or put them in the chamber afterwards to speed recovery. And it's still used that way now, to help speed recovery from surgeries. But then really significantly, it kind of became much more mainstream when we had a global pandemic about 100 years ago. We had the Spanish flu in 1918, and everybody freaked out because there were people dying everywhere, right? So they're like, oh my God, what can I do for this respiratory infection that's killing all of these people? Does that sound familiar to you? I mean,
might sound
a bit familiar, right? And so Dr. Orville Cunningham, who was in the United States, actually in the Midwest, right here in Ohio, he, in 1918, discovered that his influenza patients that were at lower altitude had better mortality rates, right? So they were more likely to survive. And at higher altitudes, they were more likely to die, right? So he started putting them into this chamber and healing them doing this. And so that was one of the first times they started thinking about using it for, really severe sickness, like acute illness, right? And then skipping forward to the 1960s, it was still not really super mainstream. But then President Kennedy's infant son got desperately sick with respiratory distress syndrome. And he was flown, medevac flown to get hyperbaric oxygen therapy. Unfortunately, he died. But there was so much media attention around, this therapy being used for the president's infant son, that a lot of money and funding started going into both the use of hyperbaric oxygen in more medical facilities, but also in research for, what else could we use this for? And so then skipping forward to 1979, the FDA finally classified it as a grade 2 medical device. And then insurance started getting excited and saying, oh, well, we can get money if we let patients use this. But they mostly only let patients, there's 14 approved conditions that insurance will cover and pay for, right? But there's actually over 100 conditions that have been used and were being used commonly in the 20th century, and are still used commonly. We just have to say it's off-label, right? And that means insurance won't pay for it for those specific conditions, but it doesn't mean it's not beneficial, and which we see commonly with all sorts of therapies. Right. So that's my
I'll save that rabbit hole for another conversation. Yeah.
Let's not get too radical, unless you're talking about free radical oxygenated species, which are important to this conversation.
Yeah, let's dive into that a little bit. So how does hyperbaric oxygen work? I know you kind of started getting into that a little bit earlier, but what are some of the physiological effects? So let's not get too technical, but how does it work? What's the function behind it?
So basically, I touched on this kind of briefly right at the beginning, saying that it increases the amount of oxygen in your body, right? So what happens is, basically what happens is your peripheral arterial oxygen levels, like the amount of oxygen in your blood vessels, increases. So normally if you know the basics of like oxygen is carried by these little hemoglobin proteins on our red blood cells through our body in order to get to wherever it's going in the body, right? And this bypasses that. Like the oxygen can just go straight into your bloodstream. It doesn't have to be attached to that hemoglobin molecule and riding along on that little red blood cell. You can just saturate your blood with oxygen. And so you can get much, much higher levels of oxygen directly into the plasma. And that's how you can bypass those barriers, because the hemoglobin can't, easily go through that blood-brain barrier. So there's, steps that it has to take for the oxygen to get up there. And the brain can't survive without oxygen, right? Like most people know that. Like if you get suffocated, or, you're at higher altitude, it can affect your thinking, right? And or if you leave the car on, right, and you breathe in a little bit too much of those fumes from the car, right, or something, that can, that goes directly and affects your brain's ability to function, right? So if we think inversely and we think about our brain needing oxygen and like how much can we get in there, this is a fascinating way to approach that, because you don't have to have those hemoglobin molecules in order to get that oxygen into your blood. So what this ends up doing is being especially helpful for healing brain injuries and all sorts of neurological conditions, and supporting the symptoms of those, as well as many other conditions, but especially neurological and brain conditions. And so, like, just kind of to recap some of those effects, what happens because you have that higher amount of oxygen is that you get increased oxygen in the plasma, right? And then you get vasoconstriction, which means your blood vessels get like more constricted in response. And you get increased fibroblast replication, and fibroblasts are what help with healing wounds, repairing wounds. And then you get increased collagen response. And a lot of people understand that like collagen is important for healing wounds as well. And then angiogenesis is like you actually make new blood vessels, which is super important in healing the brain, but also in healing other wounds or in other parts of the body that maybe don't normally get as much oxygen. You're creating new pathways for that oxygen in the long term to get to those parts of the body. And that's very important. And that's also important when we think about like people that have blockages in like their heart that's preventing enough oxygen to get through, right? And if we can build more little blood vessels, then the heart is getting more blood able to pass through to it. Or the brain, if you've had a stroke in your brain, sometimes you'll get, a stroke is basically like the blood isn't getting to that spot of the brain anymore. And then you can have damage to the brain, right? You can have cells in the brain, neurons in the brain die. And so we can rebuild that blood supply and then kind of help to rebuild some of those neurons and regain function. And so it also helps, that higher level of oxygen is also going to increase your leukocyte function, and your leukocytes are important to your immune system. So helping, again, another way of helping you fight off infection. Yeah. And
that's awesome. That's
a quick recap.
Yeah. Real quick, like for those who haven't experienced this, and I know you talked about the chamber, you step into the chamber and it's deflated until you turn the oxygen on. Real quick, can you give us, like, what does it look like? Do you sleep in there? Can you, like, read a book? What are you doing in the chamber? And how long are you in there?
Those are all great questions. So initially, before I put anyone in the chamber, or before anyone puts you in the chamber, they should do a brief, like, check-in with you, a brief health history, just to make sure that it's an indicated therapy for you and that you don't have any contraindications. Sometimes people come in with a prescription already, and they've already been cleared by a doctor, and sometimes they don't. And so then I need to take a little more time to check in with them to make sure they don't have a contraindication, which we'll talk about in a little bit, I'm sure. Not that there are very many of them. There are very few reasons that you wouldn't be able to do this therapy. So after I've done that check-in, I'm also going to check that you have had some sort of snack beforehand and that you're well hydrated, because hyperbaric oxygen can lower your blood sugar levels by up to 60 points, which can be great if someone has diabetes and they have really high blood sugar levels. But it also can be an issue if you have diabetes and you have low blood sugar. So you always want to check in and make sure you've had some sort of snack on hand, right, to eat beforehand, because it boosts your metabolism, right? And so any sugar that's in your bloodstream is going to be used while you're in the session. So then we're going to ask if you want any blankets and some pillows. You have the choice of either laying down inside the chamber or being propped up on pillows, and you can change your mind as you're in the chamber. So you're going to be handed either a nasal cannula that goes, these little two tubes that go into your nose, or an oxygen mask, depending on what sort of treatment, how much oxygen we really want you to be breathing in, depending on how severe your pathology is. And so we'll have you climb into the chamber. There's a little zipper on the side of the chamber that you're going to climb into, and then we'll zip you up. And some facilities also will use an oxygen concentrator that we will set to 100% oxygen, and it will be attached to the chamber with a little tube, and then your mask is attached to that on the inside of the chamber through a connecting tube, and that boosts your oxygen delivery inside the chamber up to 35 to 40% free flowing oxygen will then be in the chamber, as opposed to just having the normal 21% free floating oxygen that we always have. So it can help to force even higher levels of oxygen into your system by boosting the amount in the chamber to begin with. But it's not always necessary. And it's still a very beneficial treatment even without using that oxygen concentrator. And so then we're going to slowly start pressurizing the chamber once you've been all zipped up. There's a little nozzle on the side that we use to control how fast you're being pressurized. And you also have that same nozzle on the inside. So if for some reason you needed to take yourself out of a chamber, you always have that option. And then as you're being pressurized, we're going to check in with your ears to make sure that you're equalizing the pressure changes, just like when you're in an airplane or when you're scuba diving and you have to take that time sometimes to pop your ears, move your mouth, take a big yawn, drink some water. Sometimes we'll give you a little bit of essential oil under your nose prior to getting in, or some gum, things that will just help you to open up those the eustachian tubes at the back of your ears and help you to pressurize your eardrum, basically. And then usually once you're pressurized, you're in the chamber for 60 to 90 minutes at 1.3 ATA. That's when we're talking about the mild hyperbaric oxygen chambers. If you're doing a medical grade chamber, that's going to be a higher pressurization. But that's not what I do. And those ones are mostly only available in hospitals. And they only deal with the really severe insurance covered injuries. And then you might take a book in with you, or watch a show on your iPad, or listen to music. Some people sleep or meditate. Some people even will do work on their computer while they're in there. It's not such a highly oxygenated and pressurized environment. It's not 100% pressure when you're in the chamber, it's not 100% oxygen when you're in the chamber. So you don't have to worry about having an electronic device in there. There's no fire risk like there would be if you were in the hospital and you were in one of the higher pressure chambers, that's a different story. Then you can't really take any sort of electronic devices in there with you. But at this lower pressure, it's not an issue.
I was going to say that sounds really relaxing until you mentioned bringing work in there with you.
Well, some people, to some people, that is still relaxing, right?
It's
Being
true.
able to
It's true.
be in an environment where no one can easily jump on you, speaking as a mother, where no one can easily jump on you or talk to you.
Right.
For some people, it might be a great chance to do some work or to read a book, or but yeah, I used to, when I first started doing the therapy, I used to think that it would be a great thing for young parents to do. It's like a nap. It's like, I used to call it a nap pod, right? Because you could go into it and go to sleep and take a nap, and it's like this 60 minutes to 90 minutes where no one is going to wake you up. It's like guaranteed no one's going to bother you unless you press the panic button and ask them to bother you, right?
Yeah.
So then after you've had your nice relaxing session, then I would come back and help you do the same process of depressurizing and slowly having your ears readjust. And it's lovely.
Well, let's touch on real quick, because I know that because of all our technical difficulties, we're a little shorter on time today. Let's briefly touch on some of the conditions that hyperbaric oxygen is great for, and then when we should avoid it. And any cases maybe also that you've seen that were really effective.
Yeah, okay. So you might have some idea of some of the conditions it might be helpful for based on what I've already said, but all sorts of neurological conditions, chronic fatigue syndrome, Parkinson's disease, Alzheimer's disease, anxiety, depression, PTSD is a big one. In fact, the military has done pilot studies. The VA has done pilot studies here in Indiana, actually, on using it for treating PTSD and traumatic brain injuries in veterans. That is, as far as I know, it's still an ongoing study. But then also sports injuries, spinal cord injuries. I've had some quadriplegic patients that came in and did sessions regularly. Respiratory infections, chronic infections, asthma, allergies, to help. It's also really helpful to help. It's also beneficial as an adjunctive therapy when someone is receiving cancer treatment or after they've received cancer treatment. That's one of the approved conditions is with insurance, is for if someone had a radiation injury. But even if someone hasn't had a radiation injury, it improves the immune response to the cancer treatment, but it also reduces your basically the damage to your healthy tissue and helps you to repair the healthy tissue when you've had radiation therapy. And it's also really beneficial for autism and any which has a lot of people that are autistic can have a lot of anxiety or depression going along with that, or just sometimes aren't aware of what their body is doing in space. And in recent years we've learned a lot about autism, that it is it really is a neurological rewiring of the brain and the nervous system throughout the body. So people act differently, perceive the world differently, have different sensory responses than people that aren't autistic. And so this treatment can be really beneficial for that as well. And
what are some that you wouldn't want to do hyperbaric oxygen? Or what are some conditions or areas where you have pause?
There are very few moments where I really pause with it. If someone has partly because it's super rare. Like if you have a pneumothorax, you're not going to get in the chamber. That's like, like that's a very acute injury. Like your lung is like, collapsed. Like that's not something you're going to walk in my door and ask for a treatment. Right. In the
Right.
hospital though, if you've had surgery or you've just had surgery or something, that might be more of a risk factor. Like, because sometimes that can be a complication if you've had a really serious accident and they've done surgery and they want to help you with hyperbaric oxygen, but maybe they won't do it until they're sure that your lungs have recovered enough. But that's not something I deal with generally. And then also another absolute contraindication coming back to cancer treatment is if you're taking bleomycin, cisplatin, or disulfiram. I can never say that one correctly. Disulfiram. You can't do the hyperbaric oxygen treatment concurrently with those cancer therapies. And then there's other times where, like I already mentioned, diabetes, right? Like diabetes, it's extremely beneficial because people's immune systems are not optimal when they're diabetic, and wound healing is slowed. That's why sometimes people end up losing toes or even feet. Sometimes they don't know that they have a wound, and they get infections and they just can't clear it. And so this can be very beneficial. You just have to make sure that their blood sugar is staying regulated as they're doing the therapy. And then also, if someone has a pacemaker, you just want to make sure that it's been cleared with their cardiologist first, to make sure that the pacemaker can deal with the changes in pressure. Again, that's not really a problem in a mild HBOT. And then in pregnancy, it's wonderful in pregnancy. We just generally don't do it in the first trimester because people are always cautious in the first trimester. And the most common side effect really is to have some sort of damage to your eardrum or just discomfort in your eardrum because you haven't pressurized properly. So if you have a history of having otic barotrauma, it's called, like, damage to your eardrum, then that's something where we'd use more caution with pressurizing. And we, if necessary, we would depressurize and take you out of the chamber and then maybe do something to help you be able to do the treatment more successfully at a later date. And then of course, if you have a brain bleed, like if you've had a subdural hematoma or something like that, then you can't get into the chamber until it's been cleared by a doctor. So if you've had one recently, but they have said, it's no longer bleeding, then I would want you to get in that chamber because it can really help to heal your brain much more rapidly. But we don't want any active brain bleeds. Yeah, there aren't a lot of
not a lot
where I see side effects. Mostly it's just someone saying they didn't pressurize quite well and maybe their ears bothering them a little bit, but usually we're communicating together. There's windows in the chamber, so we're communicating, checking in with each other about, how your ears are doing throughout the treatment. And I might offer suggestions of, you could open your mouth really big or try drinking some of your water, or sometimes we just have to depressurize down to a sweet spot and let you sit there for a minute and then we bring you back up again and it's fine. So I think that kind of moves into like, sometimes if someone's having a hard time doing the therapy, then I'll combine it with other naturopathic treatments as well. Like craniosacral therapy, it can be very beneficial to do alongside it, especially for people who've had head injuries, or people that have sinus congestion and can't clear their ears. Doing craniosacral therapy and releasing the movement of the bones in the head can help to open up the eustachian tubes and allow them to pressurize more easily. But I mean, in talking about all of this, like, you know, some of my favorite treatments that I've done have been with people that, you know, have had some pretty severe neurological conditions. Like there was a young boy that I treated for a while, who was only 2 years old, and he, you know, was very smart and just was having a hard time communicating his needs, and so he was banging his head a lot, and so he got some concussions. And so he came in to see us to get hyperbaric oxygen therapy. And you know, he would always come in and he was really agitated, and he was stimming a lot, and he couldn't really communicate what he wanted or needed, and he would still kind of try and headbang even though he'd already had concussions. Or it was like he wasn't quite sure where his body was in space, right? Which is common with autism. So he might hit his head against something just because he didn't realize it was there, right? So he would go into the chamber, and he would go in with a parent, which is a really nice thing about these treatments, because then the parent gets the benefits as well. And he would always come out of the chamber feeling much more calm in his body, and much more able to communicate, whether that was verbally or non-verbally, and much more aware of where his body was in space, less likely to hit his head, and not complaining as much of bright lights, which he had issues with his concussion, and was able to recover from the concussions, as well as, you know, not banging his head as much in the future because he was more aware of what his body was doing. And that's just one example.
That's an incredible story. Like, I love hearing that. It's I mean, there's no words. Like, when you have a child that is having trouble expressing themselves, and they can find a way to get to that place where they can start expressing themselves, I think that's huge. It's huge for parents everywhere out there that have autistic children, and that's a growing population.
Mm-hmm.
So,
yeah, it's really.
How often do you find people usually need to go in for hyperbaric oxygen?
That's a good question. So, if someone is just has had like an acute injury, like a sports injury or something, generally, it's going to be less sessions. Maybe like 10 sessions or so is kind of a standard starting point. Or if someone is going to get a treatment prior to surgery and directly after surgery, we usually suggest a minimum of 5 sessions before the surgery, and then 5 immediately after. And then to finish answering that question, and then I'll go back to something else. And then if you have a more chronic neurological condition or a brain injury, we're going to be thinking about more like 40 to 80 sessions as a starting point. And this is crucial because in order to have these changes, you need to build up the oxygen levels in the body and try to keep it there at a sustained level over a time period. So that means that these sessions, if someone has had a concussion or a traumatic brain injury, or even if they're autistic and or have Parkinson's disease, whatever neurological condition it is, you really want to get them in there ideally 5 days a week, so that oxygen level every day is getting boosted in their system and staying at an elevated level. And then they do that for 40 to 80 sessions, and then usually the changes you see are lasting, right? And some people like it so much they go out and they get a chamber for themselves. Disclaimer, I don't sell chambers, so that was not like a pull to come buy a chamber from me. But some people find that they get so much benefit out of it, and they know they're going to use it long term, that it's financially better for them to just get a chamber that they can use at home, which is possible as long as you get a prescription from a physician. And Yeah. So you really, really want to build up those levels of oxygen. But even in as little as 10 sessions, that's like 5 days a week over 2 weeks, you see a huge change in the healing that occurs for people. I had a patient years ago who had PTSD. They were a firefighter, and they'd been working as a firefighter for several decades, and so they had many concussions over that time period, and they had severe PTSD as well as these concussions, right? Pulling people out of burning buildings leaves a big mark on a lot of people.
Yeah.
And also the toll on your body physically and on your lungs, right? It's a huge, people often get lung damage from being a firefighter, especially over that long time period. And all those concussions can cause, kind of cognitive fatigue, and just everything changes, right? Sometimes your personality even feels like it's changed. And then combine that with PTSD. Like this particular patient, he had all of these things, right? And one of the most significant moments that stood out for him was, he was in a building and he had a beam in the building fall on him, and he passed out, because the beam hit him in the head, and someone, carried him. One of the other people carried him out of the building. And that had always really stuck with him. And that is not something, that's not uncommon for firefighters or veterans to have those sorts of, traumatic experiences that are also combined with, significant physical injuries or head injuries. And hyperbaric oxygen kind of just hits all those points in treatment for them. And so he did the therapy with me only for 2 weeks, and then he decided he was going to buy a chamber. So I only saw him for 2 weeks of that treatment time. But even within that short period, his, all of his symptoms, PTSD symptoms had, reduced drastically, and his cognitive function had increased, his energy levels had increased, his fatigue was significantly reduced. His pain from all of his previous injuries was basically gone at that point.
Wow.
And so, and just his outlook on life completely shifted as well, because those things were getting better.
Yeah.
And that's something I have seen, over and over again with people that have gotten this therapy, is that, some of them prior to getting this therapy are unable to work, especially people that have had brain injuries. And, after the treatment, because they have this lasting cognitive improvement, many of my patients were able to go back to work, myself included. Like, I had this treatment after having a concussion. It's how I found out about it initially. I went and did all of those series. And it was the only treatment really, after doing all the other naturopathic treatments, that really shifted things. I reached a plateau cognitively and fatigue wise, and this therapy, I would come out of the chamber and I would feel like my brain just clicked again. It just worked. And that was something I heard from patients over and over again, but also I would see them come out of the chamber, and their energy was obviously increased. They seemed brighter and happier, and their movements would be more steady. Like my Parkinson's patients, their movements would be more fluid, and their gait would be more fluid, and their ability to walk would faster, and their fatigue would be reduced. Even just in doing one session, you could see that when they came out of the chamber. And their speech pattern, people that had head injuries, their speech pattern would be clearer. They would just tell me they felt like they were themselves again. There was a light that had gone off in their brain when they had their injury, and it came back on again. And that, I can't speak highly enough for this therapy. especially for people that have autism or traumatic brain injuries or, any of the neurological conditions. I have just seen so, you might always be autistic, right? Of course, because it's not a disease, right? Like, but does that mean you have to like live a life that feels horrible to you, right? Like,
Right.
This therapy for so many of my patients allowed them to live their best life. And that, I think, is a really important part of what being a healer should be, is helping people to be their best selves, to live, the highest quality of life that they can.
Yeah. I can think of no better note to end on than that. I want to thank you so much for your knowledge, your expertise on hyperbaric oxygen therapy, and everything that you're bringing out to the Midwest with you, because we need this. We need this here so much. I do know of a couple places here in West Michigan where we can access hyperbaric oxygen therapy. But Indiana, you're bringing it down to Indiana, so congratulations on that. Dr. Rebecca, if there's anywhere that people can get in touch with you and ask you questions, or if they want to learn more, where can people find you?
That's a great question. People can always email me. My email is Dr. Rebecca, so DrRebekah @listeningways.com. My practice is called Listening Ways Naturopathic Care, located in Richmond, Indiana. I'm right up above the Roscoe's Coffee Shop, which is a very popular location here in town. So if you have ever been to Richmond, you'll know right what I'm talking about. And I also have a website, listeningways.com. Feel free to check that out. And hopefully I will be back again to talk with you, Dr. Holly, because this has been just delightful.
It's been so much fun, so much fun. So just hang tight there for me, Rebecca, for just a few minutes. And I want to thank all of our listeners for tuning in to today's episode of Mind, Body, Luminosity. I hope you found our discussion enlightening and empowering. And remember that your health is your greatest asset, and investing in it is key to living a fulfilling life. If you enjoyed today's episode, please don't forget to subscribe, rate, and review. And leave us some feedback. Let us know if there's any other therapies or treatments that you want to learn about or learn more on. And until next time, stay curious, stay mindful, and stay healthy. Wishing you wellness and abundance until we meet again. The information provided in this podcast and supporting material is for general informational purposes only. It does not constitute the practice of medicine or other professional healthcare service, including the giving of medical advice. I am a doctor, but I am not your doctor, and no doctor-patient relationship is formed. The use of this information and any materials linked to this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they may have, and they should seek the assistance of their healthcare professional for any such conditions.